Hello, my name is Dr. Rehana Eftikhar, and what I will be discussing with you guys today is an approach to Gerd for the NAC OSCE. This video is a part of the STARMED medical education programs, and before I continue, I would like to clarify that this video is strictly for educational purposes only. So what exactly is Gerd? Gerd stands for gastroesophageal reflux disease. It is a digestive disorder that affects the ring of muscle between the esophagus and the stomach. This ring is otherwise known as the lower esophageal sphincter, and when it becomes weak or relaxes when it shouldn't, stomach acid repeatedly flows back into the esophagus. This can cause discomfort and over time may lead to precancerous changes in the lining of the esophagus. When taking a history, you may encounter symptoms that will overlap with other conditions, and that is why it is extremely important and crucial for you to rule out other differential diagnoses. In this case, and based on the symptoms that may be present, some of these may include acute coronary syndrome, stable angina, peptic ulcer disease, gastritis, esophagitis, achalasia, and malignancy. The signs and symptoms that a patient may present with are chest pain or epigastric pain. On further questioning and history, the patient will clarify that there is no radiation of the pain to any other part of the body. Another common presenting complaint that the patient may present with is burning sensation in the chest. This is usually worse at night, when lying down, and after meals. They may also complain of metallic, acidic, or sour taste in the mouth, regurgitation of food or sour liquid, chronic cough, hoarseness, and bad breath. Risk factors that may make a person more susceptible to developing GERD are obesity, pregnancy, smoking, hiatal hernia, gastroparesis, and certain connective tissue disorders. There are certain triggers that may aggravate symptoms further in a patient, and they include eating large meals or eating late at night, eating certain foods such as spicy, fatty, or fried foods, consuming certain beverages which include alcohol or coffee, and certain medications such as aspirin, antihistamines, or calcium channel blockers. Complications that can arise as a result of GERD are as follows: aspiration pneumonia, which is basically an infection of the lung from inhalation of stomach acid. Because the esophagus is exposed to stomach acid for quite some time, it may lead to tissue breakdown and inflammation of the tissue, which is known as esophagitis. This may go a step further and cause scar tissue formation and narrowing of the esophagus, which is known as esophageal stricture. Esophageal ulcers is also another complication that may occur, and it in itself can lead to perforation and bleeding. As I mentioned before, over time, precancerous changes to the lining of the esophagus can also occur, and this is known as Barrett's esophagus. There's also a slightly increased risk of developing esophageal cancer in GERD patients, specifically adenocarcinoma. Investigations. Usually GERD is diagnosed based on history and physical examination. However, those who do not improve with simpler measures or in whom the diagnosis is not confirmed, the following tests can be done: esophagram, upper endoscopy, esophageal manometry, ambulatory 24-hour pH probe, and esophageal impedance pH study. The first line of treatment is usually lifestyle modifications, and in majority of the patients, that is all that is needed to treat their symptoms. Patients are asked to avoid common food triggers that they are aware of and that they know can aggravate their symptoms. They are asked to avoid highly spicy foods, eat mindfully, and to stop eating at least 3 hours before bedtime. Furthermore, they are also asked to try to lose weight, wear loose and comfortable clothing, to avoid smoke, and if they are smokers, to try to quit smoking, to try and exercise on a regular basis, to raise the head end of their bed, and to sleep on their left side. If patients complain that they do not notice any changes in their symptoms or only slight changes in their symptoms, a trial of medications can be given to them. Some examples of the medications that are used are antacids, which work by neutralizing stomach acid, H2 receptor blockers, which reduces acid production, and proton pump inhibitors, which not only block acid production but also helps to heal the esophagus. As a last resort, when nothing else seems to work, surgery and other procedures may be tried. Some examples of these are fundoplication, transoral incisionless fundoplication, and Link's device, to name a few. Counseling is also a very important part of the treatment plan. You must advise your patient to report immediately to a healthcare provider if they notice any of the following: unintentional weight loss, bumps in the neck region, change in stool color or blood in the stool, or trouble swallowing. This is because it could indicate that a complication has occurred and it may require further investigation such as an endoscopy or a biopsy to be done. That is why it is extremely important to involve a healthcare provider as soon as possible so that we can make sure that the necessary investigations are done in time. Thank you so much for watching this video, and I hope it was helpful.